So it gave me an opportunity to kind of return to the roots of medicine and really just be able to serve our patients and give something back to the patients.
I think Operation Access is an amazing program. It's really heartening to be able to take care of people who desperately need surgical intervention and allay their fears about being in debt up to their eyeballs for the rest of their lives. It's very satisfying, and it reminds me why I went to medical school.
Operation Access was a result of a conversation in 1992 with Bill Schechter, a total stranger to me, but became one of my closest friends, about the tragedy of lack of access to health care in San Francisco. The hospitals at that time were so busy with emergency rooms being on divert and overflowing Monday through Friday, but were totally empty on the weekends. So we, in very simplistic terms, said, well, this is easy. Why don't we use the hospitals on the weekends to provide care for people that can't afford care during the week, and then everyone is satisfied with that model.
When you kind of put money and finances and, you know, big names and PhDs and doctorates away, that everybody just has the same mindset of just, we're here to make things better.
We have, it's like a three-legged stool. We have medical volunteers, we recruit medical volunteers, we work with clinics, and we're a significant resource to the clinics. And then we work closely with the patients and we provide interpretation, medical interpreters, and we have culturally competent case management and language sensitivity. So we have this really organic three-legged stool.
They talk to the patient, they do the interpreting, they set it up with my office staff.
We serve 6 counties, and each county, each community has certain needs.
Lo que pasa que no puedo comer normal porque nada más empiezo a comer mis alimentos y se me empieza a inflamar, se me sale como una bola y es lo que me causa mi también forma de vestirme. No puedo usar ropas a que vayan hasta la cintura porque me molesta. Como cuando tengo una tos, cuando voy al baño, cuando tomo agua, lo primero que siento es el dolor en la hernia.
It was like if it was happening to me, because like she's my mom.
Tenemos que buscar la manera de que me la quiten y todo eso, pero como realmente nosotros no tenemos ni aseguranza ni nada médico aquí, entonces siempre estábamos esperando y a ver cuándo podíamos hacerlo y cuándo podíamos hacerlo.
Estoy contenta porque ya voy a descansar primeramente Dios y pues agradecida que me hayan ayudado así para que me la quitaran. Ojalá siga adelante con esta ayuda, porque pues en realidad son a veces problemas que le salen a uno que no puede uno atenderse.
I can't wait to see her. I can't wait till she gets out, and I'm willing to help her, like do anything that she needs help with.
You see the patient, and then you just talk about what you plan on doing, just as you would with any other patient, and then you don't even have to deal with insurance companies. You just get it scheduled, and it's pretty easy.
At Operation Access is friendly and helpful, and they make it very easy for us, and the patients are very grateful for the opportunity to come in and have surgery. So it's been a really rewarding experience.
I knew I needed some help, and because the economy had slowed tremendously, I was not able to afford health insurance or pay out of pocket. I've been working as an upper cervical chiropractor for 3 years now. Soon after I started this new career, the economy fell apart and my clientele base dropped dramatically. And although I'm able to pay my basic expenses, including overhead, I did not have enough money left over for paying for health insurance or for paying for medical costs out of pocket that were significant.
Selena came to me through Operation Access with a large fatty tumor, which we call a lipoma, in the crook of her left arm, right here in what we call antecubital fossa. And it had been there for 6 or 7 years. It was very large, and she considered it very unsightly. She would never leave the home without long sleeve shirts on. I'm sure most of us who went into medicine went in to help people. And honestly, the bureaucracy has gotten so painful at times that a lot of doctors just don't want to deal with it anymore. Operation Access pretty much takes care of that all. There is no bureaucracy. It's just nice, happy, healthy people that come in and need something taken care of.
Me siento bien y me siento contenta por lo que hicieron y pues también le doy gracias al doctor por lo que ha hecho y ha donado su tiempo y que cada uno que le doy gracias a cada uno por el tiempo que han tomado.
I suspect that our current economic situation is going to be with us for some time, and although it may improve, and I'm sure that both now and in the future, there are going to be thousands of people in the Bay Area who really need medical help and cannot afford it, and they're not aware of Operation Access.
There seems to me to have been a rise in Operation Access cases. It does seem like we're seeing more patients come through the operating room with Operation Access.
The Operation Access Institute was just established last year. And the purpose of the Institute is really to facilitate the replication of our model, because we've been encouraged by both the American College of Surgeons and by Kaiser Permanente, among others, to assist other regions of the country that are interested in replicating the successful model that we've developed here in the Bay Area.
I remember one gentleman, a young guy, and he had torn his meniscus badly. And that was one of the first cases that I followed from beginning to end with Operation Access. That's when it really, really hit the value. I mean, he couldn't even work anymore. I followed that case. He got the operation, and 3 years ago, he came back and he told me he was finally playing soccer again. I mean, it worked really, really well. I was very happy with that, and he was so thankful.
I think it's painfully clear to anyone living in America in this time that our healthcare system is in crisis, and we're really grateful for groups like Operation Access that bring together people who need healthcare and who don't have access to it.
I never thought that she would actually get operated because we didn't have no insurance or anything.
Me han llamado con tiempo, me han dicho para la cita y así está muy bien.
Start right now. I mean, it's the greatest thing you can do.